Alaji Usman Dahaba, the UDP constituency chairman, told the people that their support must translate into votes if they want to effect any meaningful change. Dudu Kasa Jara told supporters that they should emulate the people of Combo, who are now resolved to vote out the APRC from power. He urged them to take a firm stance and turn out in their numbers to ensure a 90% victory for Dabo. Jara said the people of Nyani and Sami to stand firmly behind Dabo, saying he is your own son. Mohamed Fadi of the Gambia Moral Congress called on the youth to embrace what he called the Vote for Change campaign, saying a UDP government will prioritize youth employment. From Jarabe Koto, the campaign caravan drove to Shanghai, then Same, where the UDP got a rousing welcome from the villagers. The caravan was escorted by jubilant supporters from the village outskirts to the main square in Same Surakunda and his great singing and dancing. After the crowd had settled, party leaders took turns to address supporters. The constituency chairman reassured the UDP leader that the three villages of Pachonki, Teruakunda, and Madina have consistently voted for the UDP and come November 24th will give their vote to Dabo. Singunyasi, the National Organizing Secretary of the UDP, that since the three villages adopted him as honorary father 3 months back, much has improved in numbers, as manifest in this turnout. He urged them to keep the momentum and remain the vanguard of the UDP party. Alaji Janko Fadi and Moro Sise called on the people of Same to vote for Dabo as they had voted for their National Assembly member. They described Dabo as the best candidate who can effectively captain the ship of state, and they have been pushed long enough by the ruling party. My Ahmad Fadi, leader of the Gambia Moral Congress, said he was pleased by the light turnout of the youth and said that this is evidence enough that victory is at hand. The Gambia, he continued, will turn a new page come election day, promising that he will lead the victory march to State House to install Dabo as president. He again pledged his unwavering support and commitment to Dabo, saying the other candidates lacked direction and the character to lead the nation. He reminded them that voting occurs only once in every 5 years, and their vote empowers leaders. Therefore, if any elected leader is consumed with pride and personalizes your power, vote him out, Party said amid thunderous clapping. Our Suzo, the Women's Party chairman in Same, promised the UDP leader all the women's vote, saying her couple has increased from 25 to 150 women. The UDP leader spoke last at the meeting and thanked the people of Sane for their support. He said the day of recognizing Sane arrived, and it is for Gambians to pass the final judgment. History, Dawa said, will judge Gambians harshly if they fail to take the last opportunity available to effect change. The UDP leader promised to establish a youth development fund that will provide credit facilities to youth to establish sustainable economic ventures. He particularly thanked the local women's mobilizer for her activism, urging the people to overcome their fear and vote for the UDP. Dawa concluded by saying that the voting system is secret, reliable, and capable of bringing change. He also hailed the UDP fans club for their consistent and unwavering support, urging them to spearhead the campaign for victory. Campaign caravan later drove to Bansang, Finance Shop, where they will hold a meeting, proceeding to Numuel for Friday prayers. Omar Jalo, reporting from Bansang for GRT.
Discussions among stakeholders with interest in curbing the spread of diabetes dominated celebrations marking International Day of Diabetes. The discussion centered on the rising number of diabetic patients in the world and the colossal amount of resources dedicated to reducing its spread. Babukar Kamara has more on recent celebrations held in the Commonwealth settlement of Sukuta.
A befitting parade in observance of International Day for Diabetes, taking shape at the peri-urban settlement of Sukuta.
Celebration of this day is to sensitize people on what to do, how to do it, and those with diabetes, what they can do, and those without diabetes, how they can prevent themselves not to get diabetes.
14th of November was chosen to be World Diabetes Day because it is the birthday of the person, Professor Banting, that discovered insulin 101 years ago. He was born on the 14th of November.
The day set aside by the United Nations in 2000 has the concern of worrying statistics that continue to poke fear, as over 300 million people are said to be with the epidemic.
There are 240,000 Gambians with diabetes, and of that, 10%, about 24,000, type 1 diabetes. So it is in the increase. And it's a very prominent disease. Globally, there are, as I'm speaking today, 310 million people with diabetes. 40 million are in Africa alone with diabetes. And every 30 seconds, somebody is diagnosed with diabetes daily.
Experts further noted Africa will experience 98% increase in the diabetes population, over the next 20 years. This, according to advocates, will increase figures from 300 million cases to 500 million within a single generation.
A lot of risk factors, when you look at them, like tobacco smoking, physical inactivity, diets and nutrition. With the proliferation of this supermarket, a lot of people are using this junk food, which is very, very, very detrimental to our health. And
as diabetes advocates continue the campaign trail, they are calling for behavioral change in order to minimize the high expenditure of $378 billion US projected to increase to $490 billion US by 2030 if nothing is done. Babukar Kamara, GRTS.
The Anti-Pneumonia Coalition recently gathered in Basse, Upper River region to heighten awareness of the ravages of the respiratory illness. The event was spearheaded by Medical Research Council, the Gambia. Fatou Jasseh reports on the sensitization campaign that dominated the program.
This year's World Pneumonia Day celebrations. Pneumonia, according to officials, is a global phenomenon that requires concerted global efforts in the fight to eradicate it. Momodu Jasseh, head MRC Bassafield Station, explained the rationale behind the event, which includes raising awareness on the millions of child mortality incidents caused by pneumonia each year. The meeting also engaged the celebrants to reflect on current individual and collective strategies aimed at preventing the threats posed by this deadly disease. It also sought to forge global partnership in the ongoing crusade aimed at minimizing the mortality burdens of the disease for the under 5.
We have heard over and over the worrying statistics associated with pneumonia worldwide. That is, it is the leading cause of death in children under the age of 5, according to the World Health Organization. And it kills almost 1.6 million children each year, more than AIDS, tuberculosis, and malaria combined, as indicated earlier on by the representative of the regional health, the director of the regional health team. But it's also important to note that up to 98% of these deaths occur in developing countries, and mainly in sub-Saharan Africa and Southeast Asia, where it is estimated that one child dies of pneumonia every 20 seconds.
Dr. Jasseh further revealed that after the introduction of the 13-valent pneumococcal conjugate vaccine, the under-5 mortality rate blamed on pneumonia has significantly reduced. He entreated mothers to promote exclusive breastfeeding and caution them against exposing children to indoor smoke, among other hazardous circumstances. For Seni BI, the reduction of mortality rate by 2/3 is the fourth of the United Nations Millennium Goals that is hoped to be achieved by the year 2015. And with pneumonia-related deaths posing a threat to the fourth MDG, he believes something has to be done to stem the tide.
The United Nations Millennium Development Goals are 8 international development goals that 192 United Nations member states and at least 23 international organizations have agreed to achieve by the year 2015. The fourth of this goal is to reduce by 2/3 between 1990 and 2015 the under-5 mortality rate. Because of pneumonia caused such a large number of under-5 deaths, almost 20%, in order to achieve MDG 4, the world must do something to reduce pneumonia deaths. In the Gambia, the Ministry of Health and Social Welfare, in collaboration with the MRC, the Gambia has made a gigantic stride to introduce a conjugate pneumococcal vaccine into the routine immunization service throughout the country.
Mfali Jiba is the man in charge of the Basse Health Center. He spoke on the main causes of the disease.
Acute respiratory infections, ARIs, and pneumonia accounts for a large number of under-5 admissions in our pediatric ward. Available records show that from the 1st of January to 31st October 2011, a total of 1,996 admissions were made in our ward, out of which 1,068 were confirmed pneumonia cases.
Pneumonia, according to authorities, is curable when reported early and given its attendant complications. Mothers in particular are being encouraged to act fast by reporting any suspected sign and symptom of the killer disease. For GRTS News, I am Fatou Jasseh.
You can also follow that story and other GRTS programs live on our website at www.grts.gm. There you can also monitor GRTS Radio Live. We'll take our first break, but stay tuned.